Hello, hello, hello. This is Truth Be Told still. I had given it up for a little bit, but after my brothers came on, Dr. Horton wanted to kind of have a rebuttal to what they talked about. Or it
That
could
was
just be an
the
extension.
that was the funniest episode that I've seen.
It was good because one, I mean, everybody's shocked that my brothers really have no idea what I do. That's
No
the first
idea.
thing. They were like, "Isn't that what you?" I was like, "I'm not an
Are you
endodontist, but
honest? Are you an oral surgeon? Isn't that what you
right,
do?
yeah." It really just put everything in perspective as much as how much I can't stand my brothers. So what my whole family, everybody was like, "Oh, it's kind of biased because they're your brothers." I'm like, that's actually the worst people I should have gotten on there. If I
Right,
wanted,
right.
if I wanted someone to like listen to me, I would have gotten other people on there. But no, let's break it down, man. Like I thought it was probably one of the best episodes because it really broke down what a lot of dentists don't want to admit to themselves, that they're not that
Right,
important,
right,
that people don't see them in high regards. And I've been saying this for years, that I honestly think dentistry is kind of racing towards the bottom.
right.
And I say this with all these free promotions, free mouth, free whitening kits and free brushing and free cleaning with X-rays and so forth. I'm like, sooner or later, you people are gonna say, well, why do I need to take dentist, to any kind of respected dentist? Because think about it. When was the last time you went to your primary care physician and they offered you free anything,
Free, nope.
right?
Yeah,
Like,
yeah.
when was the last
Yeah.
time you did that? It doesn't make any
Free
sense.
prostate exams would they
Right.
be?
Right. And that's what bothers me. It's like we're literally racing to the bottom. That's my
Right.
thought process. And maybe you can speak on that, yourself, but yeah.
Well, I think two things. One, we always like to see and project what we feel about ourselves. And you're right, we fail to acknowledge what the patients perceive, right? So when it comes to our marketing, how we build our practice models and all that, we see the inherent value in what we do. But I think, a number of your brothers are like, well, where's the cheapest? Because that's where we're going to go. Because
Right.
for a lot of people, especially within a certain age group, like finances are tight. You're on a budget, and so you have to be hyper conscious of that, right?
Right.
Um, but a lot of us don't necessarily want to think of ourselves or our services as simply a monetary grab bag of discounts, right?
Well, but okay, let
Um,
me challenge a little bit on that. Do you not think that that's why corporations are coming into the dental field? Do you not think why big money like a hedge fund is coming to the dental field? Because they see the value, the monetary value. They don't come in there because they want dentists to do well.
right. No, no, you're absolutely right as far as where the industry is going. I think we've been neglectful of what patients need and what they perceive. And so for the longest time, I mean, you've probably seen this where someone comes to town and they're running an implant special, I mean, hell, you go to California, you see them for $999, right?
Right.
Implant abutment crown.
Right.
And everybody scoffs at it like, oh, how dare you? You're undermining the profession
Right.
and blah, 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 which to a certain extent I get because we're looking at our services from the value that we have learned to understand and project onto what we do.
Okay.
But we're not taking the time to understand the consumer. And that's where a lot of these corporate entities can come in and be very successful because they're just consumer driven.
Mm-hmm.
What does the consumer want? What type of marketing do they want? What kind of free stuff do they want? Let's throw it all out there because at the end of the day, if we can get the volume and we can get enough numbers, we'll squeeze the 7 or 8 percentage points that our, you know, capital
Investors.
investors
Yeah.
need to get back. And I think as especially private owners, we have to be cognizant of what type of messaging our patients are receptive to, and not necessarily that we have to play the same game, but we have to understand we can't just simply go out there and say, well, my prices are what they are because I'm a specialist and I bring value. Like we have to know
Well,
what they
apparently that
listen
doesn't mean
to.
anything.
It doesn't mean
It doesn't mean anything.
no,
Apparently, being a specialist means nothing.
nothing.
In the dental field anyway. And so
Right.
so then the question I have is this just poor education on our end? I've always said, and people are gonna not be people are gonna be upset with me when I say this, but the American Dental Association, I get it, right? There's a lot of lobbying that they do that
Right.
we don't see. But I truly believe that we're missing the mark when it comes to the value that we can get from patients, the education that we could put out there for patients. You know, why don't we do advertisement on TV? Why don't we have, pediatric dentists going into elementary schools? Maybe that should be a part of their membership, is they have to at least attend one elementary school to kind of educate the future. Because
Right.
if they know, then they'll do better. Right. I mean, my brothers and them, they were all basically saying the same thing. Like, hey, we don't know what you guys do. We feel like you guys are basically salespeople.
Right.
Right. We think
Used car salesman.
we
Yeah.
were right. It was like what? It was used car salesmen, real estate agents, and then us. I remember that. I was like, wow, we're at least three, I guess, But do you see what I'm saying? Like, to me, I look at this and go, there's a big fundamental issue here. When people don't respect what we do, they think we're trying to sell them something. And on top of that, they said something that was very interesting to me. They said, well, aren't I the preventative measure here, and aren't you the repair person?
Right.
And I don't know about you, but that was never the game plan. We were supposed to be the preventative.
Right.
Right. We were supposed to be preventative. We're supposed to be educating the patients enough to know how to get them to prevent issues. So that's why we talk
Right.
about, preventative measures. That's why you come in. That's why, we do SRP, so you don't develop periodontal disease, whatever it may be. But that's
Right.
not coming across the patients. We're
Right.
repairmen and women.
That's what it seems like. I mean, how many patients do we see only when something hurts, only when
Right.
something breaks, right? And how much of that is a consequence, not of necessarily of just our lack of educating patients, but an insurance industry that dictates what's quote unquote important or needed,
Well, I
right?
mean, so is it insurance fault because insurance pays for them to come twice a year?
I put a lot of onus on the insurance company because
Okay.
I feel like even in medicine, people aren't very compliant with going in for their annual checkups
Right.
and,
Right.
or compliant with their medications.
Right.
I mean, hell, we see it all the time in as a GP or even as a periodontist, people with uncontrolled diabetes. So there's clearly a lack of value that the population puts on their own health,
Right.
even when it comes to medical issues. Now you add the fact that at least with medicine, yeah, even if they have copays, there's no limit. And
Okay.
back when there were limits, it was like a million or 2 million,
Right.
right? With
Right.
dentistry, it's like 1,500,
Right.
maybe 2,000.
Okay.
And so I feel like that almost trains people to say that my dental health is only worth no more than 2,000 a year.
I see what you're saying.
You know what I mean?
I see what you're saying.
Because I got to live life. I got to pay the bills. I got to pay my car note and put
Okay.
food on the table for a lot
Right.
of Americans. And so I always wonder how much of that is us kind of raging against the machine that we didn't build, but then they're looking to us to fix it. And I know a quick fix: take off the limits off dental insurance.
Hmm.
Cover as many visits as, preventative visits as is required. I mean, more than anybody, it's like, no pun intended, it's like pulling teeth to get insurances to cover a 3-month perio
Right.
maintenance because
Right.
a lot of them only cover them once every 6 calendar months,
Right.
you know?
Right.
So I think it's a bigger game at play. And we definitely have to step our game up as far as patient education. I agree with you 100% on that. But sometimes I almost feel like there's a futility around it because, we don't control the pocketbooks and the financial strings of our own industry.
Well, okay. So let me again, I guess, challenge a little bit. Now I'm going to play the devil's advocate back and forth here. Ready?
Mhm.
So you said we don't control, the pocketbooks and stuff, but I don't know if we do a good job of putting importance on certain things,
Mhm.
right? I believe that a lot of dentists are now model seems to be how many patients can we get in and out of the door.
Right.
So if you have to see 20 patients, 30 patients, whatever it may be, how much time do you actually take to discuss treatment plans, to talk about what you're about to do, what the patient needs,
Right.
right? Versus just having you come in. Oh, okay, so this is it. Any questions? Okay, cool. See ya.
Right.
Versus sitting down and showing pictures and descriptions and models and whatever it may be. I think
Right.
our biggest problem is we're not showing patients how important certain procedures are, how important their oral health is,
Right.
right? If you go to the doctor most of the time because you're sick, right? You can feel that.
Hmm.
If you go
Right.
to the dentist, they're telling you stuff you can't feel.
Right.
I had a specific great example today was a patient who had recession all the way through. And the one thing she kept saying was, well, I'm gonna wait off because I don't feel any different. It doesn't hurt. And I said, you're absolutely correct. But again, I'm trying to prevent something from getting worse.
Right.
I know it doesn't hurt. You said that to me multiple times, but I honestly need your mindset to change from it doesn't hurt to how is he going to prevent this so it doesn't get worse.
Right.
And that's the part that we don't take the time to listen to patients and we don't take the time to educate patients. I
Right.
honestly believe the dentists are doing a horrible job because we're so overwhelmed with how many patients can we see. And yes, maybe insurance is the reason, right? But is it
Right.
also our greed level, our greed factor? Do we want to keep up with the Joneses versus doing what's right for patients? Do you see what I'm saying?
No, I get it, but
Because
and
we were
and that
probably
and that's
promised so much, right? When you were a dental student, you were promised, I'm sure, Lexus and BMWs and we were promised a lot, right? And
now
so
the language is Teslas and
right, yeah. So
yeah,
where are we at now, right? Shouldn't
yeah,
I be that doctor who drives that nice car and so forth? And then when you get out, you had $300,000 in debt, which is the average now. And you're
right,
making, I don't know, 100 to 150 or whatever it may be. For a normal
right.
person, that's really good money, but for dentists, it doesn't seem to be enough.
It doesn't, and especially when you consider the fact that most dentists, if they graduate at like 27, 28, like they're getting a pretty late start on their financial abilities or ability to earn a good healthy living, right?
Right, right,
And so there's always that pressure. There's the pressure of, you know, take for instance Delta Dental. They slashed how much they pay for pro fees,
right.
right? So now if you have an insurance that's paying, $77 for a pro fee, but now we have to pay our hygienist $70 an hour, you know, that extra $7 doesn't even cover disposables,
Right.
right? So it
Yeah,
does turn into a game of like, well, how many patients can I churn? Now to be profitable in that hour, I need to see twice as many patients.
it
And
is.
unfortunately, one of the byproducts of that is our ability and our time to educate patients just goes way out the door.
That's it.
Um, because think about it, I'm in school right now. I literally get 3 hours per patient.
Right.
I
Right. You
literally get
have
as much time as I want, right? But and it's funny because I'll talk to some of my classmates and we kind of venting about the programs and there's always that comment of, we're out here making this program money. And I'm thinking to myself, like,
no, you're
when
not.
you look at how much we're charging like a third of what the
Right,
community charges, right?
right, right,
We're literally taking 3 hours per one patient,
right,
seeing two patients a day.
right.
That's not even covering the overhead of the rent of the clinic,
Right,
right?
right.
But we are having a better rapport and better outcomes with our patients
Very
because we
true.
have more time to spend with them.
Yeah.
And I can see that dichotomy so clear coming back from that,
Mm-hmm.
and I still work Saturdays. So Saturdays is like patient, patient, patient,
Go,
patient.
go, go. Yeah.
And sometimes now I feel bad, and I've actually had to ask the staff in certain type of appointments, like, hey, give me an extra 30 minutes on that appointment because I don't want the patient to feel rushed. I do want to be able to really hone in on post-operative instructions and why not doing this is important, why doing that is important. But in real world dentistry, I mean, they've been reducing our costs. They've the competition, even if for your regular cash fees, is driving the price low. So really, the only way to make that up is volume, because wages are going up, benefits are going up,
Right.
rent is going up, cost of goods is going up. But like you said, we're racing to the bottom on prices because there's so many dentists, and maybe that's the problem.
So you think there's too many dentists in
I
in isolated areas, I guess, right? In the city
yes,
versus
yes,
rural areas. So there isn't enough dentists in certain places that need to have dentists, but in other places like the New Yorks, the LAs, and yeah,
yes,
there's literally. I mean, I
yeah,
know certain places where there's like 5 dentists in the building.
yeah,
So it's crazy to me, man.
yeah,
I mean, okay, so another thing that my brothers had mentioned that they don't really see the benefit to specialists when their general dentist could do everything.
I had such a hard time listening to that because you know me, I'm a GP through and through,
Right.
despite me being halfway through specialty school. But I think was it
Shalisa.
Shalisa. She brought up, she had the best explanation for that. She said that she has a trust that's built with her general dentist.
Right.
And if her general dentist looks in her eye and says, hey, I can actually do this, I'm competent at this, she's going to trust that.
Right.
But she also trusts that if he thinks or she thinks that it's beyond their capabilities, then whoever they get referred to, that trust is then conferred to whoever the specialist is.
Okay.
And I think that's the best way to look at it. I know we like to think that, you know, there's a special place in heaven for us specialists because of what we do.
I thought that
You know,
heaven was here.
everyone's here,
The
right?
second you become a specialist, this is heaven.
Right.
You know what I mean?
But you know, the truth is,
Yeah.
you have there's levels to the game, right? And so I know, even just from what I'm seeing, a brand new periodontist or a brand new endodontist, you know, is still very green. And there's some GPs out there that can run circles around some
Yes.
brand new graduate specialists in whatever specialty, right?
Right.
Do I see a lot of stuff coming out of the GP world that I wish wasn't? Absolutely. I think you see that too, right? Part of being a specialist is not only are you doing stuff for the first time, but you're kind of rescuing your colleagues,
Right.
you know, when they're in over their heads or something doesn't go right. And so I do think that instead of looking at it as a competition, they're giving us more work in that sense, right?
Yeah.
Okay.
Yeah. No,
So,
true. True.
I mean, I know, you know, you're fixing
Yeah.
a lot of stuff
Right.
that was, you know, had to be fixed.
Right.
But there's also, I think there's going to be a lot of GPs that are going to be in areas that specialists aren't willing to go.
Right.
Right. If you're making good money, if you're from the city, you're going to want to stay in the city. Right. I don't know what the most metropolitan area down by you is, but you know, up in Seattle, you want to be in Seattle or Bellevue.
Right.
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 And I can't blame you. You didn't spend 13 years of schooling to have to go to some rural town if you have no connection there.
Right.
And so I think there's a large market for us to be in the educational industry and teaching these GPs what we know, so that they can go and serve populations that we may not serve. Now, mind you, a fair amount of those GPs are going to stay right next to us in the metropolitan area, right? But I think that is what it is. I think if there's one thing that I've seen, even as a GP, that was kind of helping some of my other fellow GPs, is that they're giving you so much stuff to fix that you can. That's how much of your business would you say is addressing previous work?
You know, it's funny. Let me go ahead and break it down and say why I think it's funny. So I can put a number, it'd probably be like half and half, right?
Okay.
I see half and I'll just do my own thing, and I see half where I'm fixing something or but the funny thing is when the patients refer to me, it's not here fix this. It's how did this implant all of a sudden lose so much bone? It's crazy. Yeah, it was placed somewhere else and now this is where you're at. So I look and go, well, when did this happen? Or I'll get this root canal was done less than a year ago. Now this tooth needs to come out. And it's amazing to me how people explain it to the patient. They're like, yeah, you know, we knew that this was probably not going to work. I'm like, imagine if you bought a brand new car, right? And then within a year, it's fallen apart and it broke down on you. You would probably take it back to that dealer and say, this is a lemon, this is horrible. How could you possibly sell me this? But for some reason, they're able to convince patients that this root canal that was done shouldn't have lasted this long. And we're lucky that we got 8 months out of this, 6 months out of this.
Right.
Then I'm taking that tooth out and I'm placing an implant.
Right.
Do you see what I'm saying? So it's not really, they don't ever want to talk about their mistakes. They just talk about it as this always happens or this happens a lot. And I'm like, this is my biggest issue is I don't know if we've gotten to the point where we don't understand our materials, we don't understand dentistry, we don't understand what we're doing, or are we just taking too many shortcuts to the point where just things aren't getting done correctly?
Right.
Does that make sense? And
Right.
and then the question I'm going to ask you this is it patients forcing us to be fast and cutting corners, or are we forcing ourselves to be fast and cutting corners? For example, I remember when you were in dental school and you had to do like a denture case, it would be 5 appointments, right? You would take the impression and then you would come back and then
Yes.
they would take you take a new impression basically with borders. And then remember that, then you would
Yeah.
have to do the wax trying and
Border
so
molding and
border
yeah.
molding and then wax trying and then making sure everything's good. Then you bring the right. Now you can probably do it in like 2 or 3 steps. I've seen people doing it in 2 or 3 steps,
Right.
if not less.
Right.
And that's what I'm asking. Is it the patient's point of view? Because I honestly think that I've seen an increase in I don't want to call it iatrogenic dentistry, but an increase in failures. And I'm trying to figure out where this increase is coming from.
I would say that there's so many levels to that.
Right.
I think that as you mentioned, a lot of dentists are under the gun. They're coming out, $400,000 or $500,000 worth of school debt.
Yeah.
They've got a job that there's really pressure by whatever owner they're working for, or if they got their own office to really produce to justify their wage, right?
Right.
So they might be trying stuff, and we've all been guilty of it. That maybe it's a little heroic, maybe it's a little bit out of my pay grade, but I'm going to give it the old college try because if it works, I could really use this, commission
Right.
on this or this percentage, right?
Right.
Patients do, and I will admit, patients do pressure GPs to try stuff.
Yes.
There's so many patients where I've heard, where I've said, hey, you know what, we should probably send this to the endodontic specialist. Oh, doc, just take it out. If I got to go to the specialist, they usually want so much money. Just take it out, right? So there is an aversion that patients have to the specialist because of pricing usually, right? It's going to cost an arm and a leg. I think a fair amount of it is if you take those two put together and you take the notion that a lot of general dentists have that, well, if this endo fails, we'll just take it out and put an implant.
Right.
Whether it's I do it or I just send it out.
Right.
The teeth, there's even amongst trained dentists, there's a notion of teeth as being rather disposable.
That's it.
Because an implant, you could replace it. And as we all know, an implant lasts for life, right?
This is what everybody's been
right?
told. That's what everybody's been told.
That's the big fallacy.
Yeah.
Yeah. So I think when you start putting all those levels together, you can really end up seeing what you're seeing, where you're just like, why did they try this? Or why didn't they send it to the specialist to begin with? Or why didn't they this? But there's so many factors, I think, playing a role that I'm not surprised when I see that, just because being in the GP world for so long, I see that the pressures. I've seen so many general dentists do stuff that they know they probably couldn't do or they couldn't do well.
Right.
They meant well. They tried, but in your head, you're like, you kind of knew that was out of your pay grade. And I may have been guilty of that of myself at some point.
Oh, I mean,
right?
I'm sure. Yeah.
Yeah, because there's pressure on us. And we're all also very ambitious people. So there's times where like, yeah, you do want to shoot the 3-pointer. That might not be your thing, but you're like, you know what? I'm feeling myself today. I think I got this.
Right.
Sometimes it goes your way, sometimes it doesn't. But at the end of the day, it's still often landing in your lap, right? Which can be a good thing from a business standpoint.
Right, but it's also frustrating.
Yes.
Because patients come to me with a lot of like anger about what happened. Does that make sense? Because they have an idea that this is not normal. They have an idea that, listen, I spent a lot of money and time on this tooth, and now I'm here.
Right.
So why didn't I just skip all those other steps and get here? And I always have to kind of reiterate that, saving a tooth is actually what we should be doing.
Right.
Right. And I know it. And I always said, no, it sounds crazy from a guy who takes teeth out and places implants. Right. I get it. But my main job is to try to save teeth.
Right.
You know what I mean? I went to school to try to save teeth.
Right.
And I think teeth are probably they're easier to deal with. And I'll just speak for myself. They're easier to deal with than implants are.
Yeah.
right? I can, if a tooth has a periodontal disease, bone loss around it, I can figure how to regenerate. Have an implant, have a bone loss around it, and
Yeah.
myself, Dr. Horton, I would have one technique. Dr. Horton will have another technique. Another person would have another technique. Put 10 periodontists in a room and say, how would we fix this? I can guarantee you'll have 10 different ways, right?
That's the story of my life in residency, man.
Right.
Yeah.
Right. And
Yeah.
the funny thing is with a tooth, we would probably all come up, it would probably be maybe like 3 different ways. But we
Right.
all kind of get the general, you know what I mean? Because I
Right.
don't think we understand implants as well as we think we do. I don't think
Right.
we understand regeneration as well as we think we do, but that's another story. You
Yeah.
know,
Yeah.
I personally believe that, yes, there's pressure, but I honestly think it's self-induced because,
Right.
like you said, right? If you're a new grad, you want to prove yourself. You want to show, um, you want to show that, hey, I can do this. You want to show that I'm the man or woman in this. You
Right.
want to impress the patient because they're probably looking at you like, oh, what is this young kid doing?
Right.
Right? Oh, what is this little kid doing? Well, come on, get out of here. You want to prove that you know what you're doing
Yeah.
versus saying, listen, this is above my pay grade. Let me send it somewhere else.
Yeah.
That's not what we want to do anymore. And
Yeah.
this is the biggest issue that I'm starting to notice, man.
Yeah.
Like we're not able to just say it's okay not to know.
Right.
Right? We're not able to just say, let's just send that money out because it will come back to us. And I think that's our biggest problem. I think dentists are too worried about money, which I
Yeah.
get it. I'll be
And at the
honest with
same
you.
yeah.
I get it. I
No,
mean,
good.
having that much dental, having that much student loans, having a lot of debt, inflation, like there's a lot going on right now.
Right.
I just don't know where the balance is, to be honest with you. You know what I mean? I've had to deal with it in the past. I just don't know where the balance is, man. What do you think?
Um, Honestly, I don't think there is a balance. I think we're just, as an industry, we're just in a slow spiral
Mm,
as your race to the bottom.
mm,
I know that's a pessimistic view to have, but
mm.
I've seen what's happening to the business model of dentistry. I've seen how it's being overtaken by the corporate world. I've seen how patients more and more are looking for expediency and immediate definitive treatment, right? And you
Mhm.
don't know which one's the chicken or the egg. Did
Mm,
we push teeth in a day?
mm,
And now patients are always looking for teeth in a day, or
mhm.
did the consumer demand teeth in a day and the industry filled that demand?
Hmm.
I'm not sure which one came first, but you kind of see these things that keep feeding each other. It's like a feedback loop,
Right.
just all the way to the bottom.
Right.
Um, and at the end of the day, patients need to be patient. Doctors need to be patient,
Right.
right?
Right.
Doctors need to be patient. Doctors need to be uh, diligent about not doing stuff that's too far above because the only way you get better is you always push yourself little by little,
For sure.
right? Um, and honestly, there's a lot of cases where I've seen where the patient actually pressures the doctor because they don't, doctor, come on, you could do this root canal. You did my
Right.
other root canal, it's just
Right.
fine. I trust you. And if it doesn't work out, we'll just take it out. But they
That's it.
never remember that conversation, right? They never
Yeah.
remember that. But
Right.
then when they get to you, because we send them to you for the implant,
Mm.
the story just has a little bit more dramatics, a little bit more
Yes.
flair to it,
Yes.
and I don't
Yes.
know why, I spent all this money on this
That's it.
tooth. But to be honest, and I don't want to be overcritical of patients, we're not necessarily, and I hope we're not anyway, putting a filling and then a crown and then a root canal, then an extraction on a perfectly healthy tooth. Like there's a
Well,
reason the tooth needed any of those treatments to begin with,
true. True.
right? And so I don't want to put all the onus on the doctors per se.
Right.
Um, I do think there's a value system that patients have that doesn't put much value on their teeth. I mean,
Right.
a lot of them, there's 32 teeth, right? And there's only 12 of them in the front. So really, how many important teeth do we have?
Brush the ones you
Okay.
want to keep, right?
In our societal value system, we
Right.
really only have 12 or 14. Right. you know. Um, but I think that's where what your brothers and Shalisa were saying is, and my theory is that because of their age demographic that they fall into, price and expediency plays much more.
Mm.
right? You brought up the notion of, do you want the CEREC crown and get the tooth today, or I could do it this way and you get it in 2 weeks.
Right.
That's a whole separate visit. So now I got to
Mhm.
take 2 half days off of work and so forth.
Right. Right.
Um, and we live in a society where people are check to check. It's not always easy to be able
Take
to
off.
not be expedient, right?
Right.
But then you get older, like me and you, and it's like, no, we won't value and quality at this age because we're more fragile because we're older, right? We see
Okay.
our timeline was
Right.
here,
Right.
now
Right.
it's
Right.
here,
Right.
and so we tend to put a lot more stock in the little things and the
Yeah.
big things, of course. But it's just like when at our age and our I don't want to say status, but at our position in life,
Right.
or station in life, our restaurant experience is different.
I see what you're
Right.
saying.
It's not that I had a bad time when I was going to Olive Garden. That was a big thing. But if
Right.
I've been working all week and I'm just craving, I want the experience, I
Yeah.
want the quality. Like,
Yeah.
no, babe, we're going to El Gaucho's tonight.
Right.
We're going to Morton's tonight, or
We're
Ruth
gonna
Chris
step
or
it up a little
something.
bit. Yeah.
Right.
No, no, I get it. I mean,
Yeah.
we all, when I was in college, I used to have the $5 pizza box. I get that.
Right.
It tasted like cardboard, but it still hit the spot Friday night.
Right. Right.
At 2 a.m. The only place that was open at 2 a.m. You should have thought twice, but it's all
Right.
good.
Right.
But okay, well, let me ask you a question, and I guess it's the big thing that kind of got out of the video, which was, are specialists as important as they think they are?
Mm.
Right?
Mm-hmm.
Specialists in the dental world, the oral surgeons, the endodontists, the periodontists, whoever the specialty is, we hold ourselves to be above, right? We know more. We have gone to school longer. We are the last line of defense. We're the ones that are able to do the extra stuff.
Right.
Then you talk to patients and they're like, I don't care who does it, just do it. Right? I don't care who
Right.
does it, just do it. It's who I trust. So
Right.
the question is, are specialists as important as they think they are?
Well, I tell you what, because I see my battery going low. Let me grab my charger real quick.
Yeah, we can
I
finish
know
up in like a minute or two.
that's unprofessional of me to not have my
No, no,
computer
no.
plugged in. But I will answer that by referencing one of your quotes from that episode, is that you don't go to your general practitioner, and if he tells you need heart surgery, you get your heart surgery done at the general practitioner.
Right.
Right. You go to a cardiothoracic surgeon.
Mm-hmm.
Right.
Right.
And so why is it any different with dentistry, where people will get specialty treatment at their general dentist? That is a great question. So are we as important as we think we are? We're only as important as the market dictates.
That's it. And right now, the market does not dictate our importance.
It does not dictate it. I think we have to sell our own importance, and we have to do it in a way that doesn't demean or put down anyone else.
How do you
It's
do
not
that,
easy.
though?
It's not easy to be a general practitioner
At all.
right?
At all.
At all. But how do you sell your specialty above? How do you convince someone to get it done at your place instead of the GP office without putting the GP office down?
And can I just say, I don't anymore.
Yeah.
Let me go ahead and tell you that what I mean by that. I don't try to hold my importance above anybody else. Why? Because I've realized that no matter what, I need to make sure that the general dentist sees my importance.
Yes.
Not the patient per se, the general dentist. And what they said was actually very, very true. I just wasn't thinking that way. And they said, and I think you said, Shalisa said this, hey, if my general dentist looks me in the eye and says, I think you need to go somewhere else, they're going to believe that.
Right.
Why would they believe somebody who they're coming to brand new, sitting in their chair, has no idea who they are? But guess what? Their family goes to Dr. Smith, the general dentist.
Right.
Why would they listen to Dr. Aka about how great he is, about his specialty or whatever it may be? Do you see what I'm saying? Right. I honestly think that we need to start honing in on making sure that the general dentist thinks that we're important.
Right.
And I have friends who are adamant that they do not teach general dentists anything. If a general
Yeah.
dentist asks them, hey, how would you do this and this, they say, just send that patient over, I'll take care of it. And to me, I think it is the dumbest thing you could do.
Yes.
Because in my mind, I'm like, if they ask you, show them. Who cares?
Yeah.
Because if they mess up, they're like, hey, who was the one that knew more than I did?
Mm-hmm.
Let me send him to Dr. Aka because he was one that told me, hey, I do this, and this.
Right.
Why are we trying to be special when we could just say, hey, you know what, Mr. Dr. Smith, you want to place the implant? By all means, go right ahead.
Right.
Right. If anything happens, I'm here. And then
Yeah.
when you do, you don't sit there and say, oh, what an idiot. Why would he place an implant? Da, da, da. And I think that's where we've gotten to, man. I really believe that. Listening and talking to my friends, I hear that a lot. Why would they do this? What is wrong with them? They're not specialists. Da, da, da.
Right.
So we have this level of, error about ourselves where we think we're important, but we were just proving that patients don't care.
They don't. And how much of that comes from academia? I mean,
Oh, very true.
I don't know what the culture in your program was like. I know what the culture in my program is, and there's a high level of self-importance and air,
Yes.
right?
Yes.
That
Yes.
may or may not be well deserved by everybody. I mean, there's some great clinicians and there's some great academics that may
Right.
not be clinicians, right?
Right.
But it does feel like everyone is trying to justify their position, justify their
agree.
degree in comparison to someone else, right? But I agree with you 100%. The best thing you could do is show your general dentist as much as they want to know, because the more they know about it, the more they are likely to refer for that treatment, right? So as opposed to, oh, we'll just do partial dentures, they've been learning so much about implants, they see the value of that patient having implants.
That's it.
Well, a fair amount of their cases are going to be above their pay grade. They're going to come to you to at least explore implants first before they do dentures, right? On that GP's recommendation. And the other thing is, like you said, you establish a rapport. And so the easy stuff you don't really need anyway.
Yeah.
I mean, if you're slow and you don't have patience, yeah, I get how, it's kind of a dog eat dog
No, for
world.
sure.
But
Yeah.
if you got an established office and you're fairly busy, do you really need that number 19, single edentulous site implant? You let them have it.
Right.
Because there's about 5 or 6 cases they're going to refer to you because they're not doing it yet. And by the time they're at your level, you're retired anyway.
There you go. There
Right?
you go. Yeah.
But now you got a general dentist you and your family can go to now that you're retired, because they'll take care of you, because
That's it.
and life is about relationships. And so I don't feel like we need to necessarily step on each other. But a lot of specialists
Do you think we do?
Oh, absolutely, bro. Listen, I don't know how many times I've been approached by lawyers asked to be a expert witness against another dentist, right? And I always said no, but I've talked to anyone that's had to go under any litigation, and I've had to go under litigation myself. There's always an expert witness, and they will say the craziest things to justify whatever position their client is trying to take. So there's an entire industry built, especially in healthcare, but especially in dentistry, around the dog eat dog culture that we have. And I don't know what prompts this. I don't even know how much money you really make, because when they come to you and propose for you to be an expert witness, they'll pay you for your time. I had one oral and maxillofacial radiologist that said every time they stake at the stand, it's 10 grand. And they're like, I literally get on the stand, I give my opinion, it might be 15, 20 minutes, and I get 10 grand for that. So why wouldn't you do it? And not that there isn't a place for it, because we have to be able to hold each other accountable. And there are people that, may make gross mistakes or negligent mistakes. And so there's got to be accountability. But I think our industry, I could do a crown today that's perfect, and the patient go in for an exam next door, and that doctor's going to find something to say about it, because they want to be able to replace the crown and oh yeah, you know what I mean? And it's a God complex, I feel like, because it's not earned. At the end of the day, we are just periodontists,
And
you know.
how do you think a patient would know if they're getting ripped off by dentists? Because they mentioned that too. They said, I go in there and I've been with this one dentist and everything was great, and I go to another dentist and I need like a whole list of stuff.
Right.
How do patients know if they're getting ripped off or not?
They don't.
Right.
They don't. Let me tell you what I've seen. Patient is at an older dentist getting ready to retire. Office, they've been going there for 10 years,
Right.
15 plus years. He's an older dentist, or she's an older dentist. They're not trying to break their neck. Everything is a watch. There's all this incipient caries that don't even may not even get mentioned because the dentist just watching them. Then you go to someone that's younger, that's probably looking at it with fresh eyes, that's not as checked out
Mm-hmm.
of work, and they're like, oh, Mrs. Jones, you need 10 fillings.
Right.
And then people are like, whoa, what? You know what I mean? And you talk to any new owner that's bought an office from an older practitioner, there's a lot of that.
Right.
Crowned, root canal posterior teeth that never had a crown plan,
Right.
incipient or no longer incipient caries that have been watched for the last 5 years.
Right.
And now you're the young buck in there that's saying, hey, you need $10,000 worth of work.
Right.
And they feel they're getting ripped off.
That's it.
Right.
That's
and
it.
I get it because I go to Jiffy Lube. And when I go to Jiffy Lube, okay, you never just get an oil change.
It's always something.
It's a list.
Oh, man.
You need your filter, your struts, your this, your spark plugs. And you're like, and I'm not a mechanic, so I don't know.
Right.
So you either trust them.
Yeah. I just wanted my oil changed.
Right? Or like the patient says, well, the car sounds fine, right? My teeth feel fine, right?
That's it. Yeah. No, I mean, it's a lot of questions, and we could sit here all night just really asking and answering some of these questions. But I just don't know where we have to start when it comes to trust. I just think dentistry is not trusted by patients. And I'm going to say this quote, and I think maybe we can end here, and then tell me if you agree with this, but I honestly think that half a dentist, and I say half, this is just my my research. It hasn't been validated by anybody else. No one has double checked it. It's not a double blind study.
It's not peer reviewed.
It's not peer reviewed by any stretch of imagination. But I believe half a dentist would be out of a job if patients were more educated.
Right.
That's what I believe, and I believe corporations would also not exist if patients were better educated.
Right.
This is my thought.
Yeah. Hey, prevention is worth a pound of cure, 100%. Because education is prevention.
Yes.
Right.
Yes.
Or at least we hope so.
Right. And then being able to know, hey, when am I being sold a bag of goods versus being sold the right thing? Do I really need that crown? Do I really need that, laser treatment and magic voodoo and this and that and that? You know what I mean? I remember like as dentistry's gone along, as we've had little fads, right? Remember Reston? That used to be pretty big a while back, right? And then it was lasers now, and now it's like there's so many different things that we decided to just build and build and build, and DNA, oral testing and so forth. And I'm not saying that there's no place for it. I just don't know if we need to do so many.
Right.
Because the question I always ask when somebody says, "Oh, what do you think about the oral laser, the oral, DNA or bacterial testing?" I go, "Okay, so you now know that this person has this bacteria and this bacteria that's causing this. What are you gonna do different?"
Right.
And most of the time they're like, "Oh, no, nothing." And I'm like, "So then, why did you?
Why did you?
You see what I'm saying?" Most of the response is, "Oh, but nothing's gonna change on my end." Then it's like, why did we do it? Why? Because we could charge for it.
Yeah.
And that's why I'm saying that, if patients were better educated, I truly believe half a dentist wouldn't have a job.
Right.
And that's probably controversial. And I don't know if you agree with me or not, but it's my.
I don't think it's controversial. I think it's a conundrum for the profession because it's a procedural profession.
Mm-hmm.
So we have a vested interest in having procedures to do,
right?
And prevention would get in the way with that, right? So expecting an industry to intercede against its own interests might be a tall order.
That's it.
But I do like your idea of maybe mandating more community involvement
Yeah.
with
Just for education.
any healthcare provider.
Yeah.
And then that, I think that would garner a greater amount of trust and have stronger relationships within the community. And hopefully dentists would be less likely to not be as honest and forthcoming and I guess responsible with their patients, since they'll have a stronger tie with their community as well, right? But now when I work in Seattle, but I live in Bellevue, like I
Yeah.
don't really treat my
Right.
community per se,
Right.
right? Whereas the old model of you had a town doctor or a
That's
town
it.
dentist, and
Right.
everyone was your neighbor and you grew up with them.
You went to church with them
Um,
and so forth. Yeah.
right. And so now it's just McDonald's. You
Yeah.
know, there's no personal touch to that.
Mm. Mm.
You
Okay.
know.
Okay. Well,
So
what I'm gonna do is I'm gonna try to see if I can get my brothers back on, and maybe
yes.
you can join me to, what I'm thinking about doing is just showing them different cases and seeing what they think. Right. What we consider to be beauty may not be what they consider to be beauty.
Right.
What we consider to be good work they may not care. And I'm trying to figure out what matters to patients.
Right.
Is it that beautiful crown that was done, or is it that, I've seen a lot of, like, I love soccer and I watch some of these Brazilian guys and their teeth are so white.
Right.
And I'm like, who would do that to this person? But
Right.
they're happy. They're just, hey, and I'm like,
Right.
why?
Right.
And I'm like, what is going on? But they love it. And this is what I'm trying to figure out, like what we consider to be beautiful versus what the patient does.
Okay. Yeah, I'm
So
down. I'm down with that.
I'm thinking something along those lines. You know what I mean?
Yeah.
But thank you, man.
Well, listen,
Yeah.
I appreciate always the invite to come on your platform. And we're linking up in Arizona in a few weeks.
We're gonna have a good time.
Yes. So I'm looking forward to that. And then we can kind of talk and brainstorm on some ideas for some cool episodes. But I do like the kind of real time talking with real patients,
Right.
people that are patients and not providers,
Right.
to get their insight, because we often kind of stay within our own echo chamber.
That's it.
And we need to
That's
be
it.
brought to reality sometimes, because our reality is not everyone's reality.
Right. And I don't it's funny, I don't know if people really appreciated the last episode. If they really listened, they would be
Right.
better clinicians, because they would actually realize, oh, I need to improve on this part. That's what matters to people.
Right.
And that's my goal, is basically to try to get people to understand what matters to your patients.
Right.
We're so stuck on what matters to us that I think we forget what matters to the people who are paying our bills.
Right.
Right. It's not a matter of, oh, let me just give them the shiny new toys and stuff. Because I even brought up, like, oh, what about technology? I don't care. They don't care. Yeah, it's nice, right? It's nice. You don't want to go to a dental office that's all broken down. But I mean,
Right.
what does it really matter? Like,
Yeah.
what matters to you? You know what I mean? Just get me out of pain. I don't want to feel pain. And that's all there is. And I want to get out of there as fast as possible.
Right.
Yeah, man. But we will talk, brother. I appreciate
Yes.
you coming on as always, man.
Same here, man. I'll talk to you soon.
Yes, sir. All right.
All
Later.
right. Take care.